It's interesting that most people have the wrong idea about the causes of sleep apnea. They say, oh yes, I'm big, I'm fat, that causes sleep apnea. The main factors are anatomical, in that the lower jaw is set back and the person has a large body weight, which includes a thick neck and perhaps a large tongue, and particularly on your back, your tongue will fall back and close the airway, which then promotes sleep apnea, cessation of breathing, and snoring. So once the tongue falls back and the airway is closed, the body will attempt to get you to breathe in some way. And what happens is that fluttering of the tissues occurs, and this sound produces snoring. So snoring is the result of the body trying to cope with the restriction of air and particularly oxygen. If you stop breathing for periods of time, the term sleep apnea is used. And you can have mild, moderate and severe sleep apnea. The reason they go to the doctor or dentist is because the snoring seriously affects the person who is sleeping with the patient who has sleep apnea. So it's because of this social context interrupting with social relationships that most people come for treatment.